Hi friends, wondering what's this all about? Well, this is the art of percussion. You know, percussion instruments are the instruments which are played with hands, tapping with hands. And this is tabla, of course, very popular percussion instrument in the Indian subcontinent. And all over the world, there are various types of such instruments called as percussion instruments. But of course, I am a physiologist, so this is not all about the percussion instruments, but the art of percussion as used in clinical practice. So this video is about the percussion, how we perform this art of percussion to come to clinical diagnosis. Let's have a brief history of the percussion. It all started with Joseph Leopold Onbrugger. Now, this was around the same time, the start of 19th century, 1800s, start of 1800s. This is around the same time when Linnaeus was putting his ear to the chest wall of the patients and trying to hear those sounds, and eventually he invented the stethoscope. So that's the time. And how the percussion came into being. Of course, this person is called as the father of the percussion. How this art form came into being in the clinical practice is that his father was an innkeeper. That's how the story goes, the restaurateur, let's say. And suppose there is making of vodka or making of wine. So a wooden barrel, imagine a wooden barrel in which all the grapes or whatever material is placed, and the lid is closed, and then it is put for fermentation. So solids will be at the bottom end, then there is the liquid which is being formed, and gases will be at the top. But without opening the lid of this wooden barrel, how would you know from outside? So tap from outside, and different consistencies will give you different sounds from outside. Thump thump, tak tak, tung tung. So he saw this being performed in that restaurant or whatever place it was, and from that the idea came that the same thing can be applied on the human body, so that human body has different types of organs with different consistencies. There are solids, there may be a liquid, there are gases, and then from the sounds, different sounds, we can come to certain conclusions. So this is where it all started. Now, when we perform this percussion on the patient, we place the hand like this and we tap with the other hand. So plexor, when we hit by one finger, it's called as the plexor, and the other hand, its finger, is called as a pleximeter. So this is just basic terminology. Now, what is the principle behind this? We are sending these sound vibrations by tapping like this. We send these vibrations into the patient's body, and according to the organ inside, means beneath the pleximeter finger, according to the consistency of that organ, whether solid or liquid or gas, different sounds will be produced, and then from that we can judge what sort of organ or pathology is present over there. This principle is somewhat similar to the ultrasound instrument or ultrasonography procedure. In that procedure, ultrasonic sounds are sent into the body, and sound energy is converted when the sound strikes the organ inside the body. It is converted into a light energy, and different images or shadows get created on the screen, which we can see, and we can come to certain conclusions. So something similar. Now, when we perform this procedure, we get certain sounds, and those sounds are called as notes on percussion. Basically, there are three notes on percussion depending on what kind of organ is there on which we are tapping. I hope you have not forgotten those terms: plexor, pleximeter. So, when we create those sounds, or rather sending those sounds into the body and creating those vibrations, there are three notes on percussion. Dull is created on a solid organ like liver or hard borders. Something solid will give you a dull sound. Tap, 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 something like that. Not exactly dhap, dhap, but it would be a very mild but solid type of a sound, dull sound, tap, tap. Then resonant. When you are above a small cavity filled with air, there will be a resonant sound. So when you are performing the percussion on the lungs, for example, lungs are made up of alveoli, small cavities filled with air. So when you tap over that, there is this kind of a resonance created within that small cavity, and you get a resonant note. So tang tang. And the third one will be tympanic sound. Tympanic note. A large hollow organ or a hollow viscous filled with air or gas will give you tympanic sound, like intestines, for example, stomach or intestines. Tang tang. So three types of sounds depending on what type of organ it is: dull, resonant and tympanic on the solid organs, alveoli and intestines respectively. So these are the notes on percussion. Now there are certain rules related to the this percussion. Let's see some of the rules. Movement at the wrist joint. How exactly you make the movement of the plexor or the movement of this hand, which has the plexor. So it should not be the elbow joint which is moving, but movement should be at the wrist joint. That's the ideal movement. Second, pleximeter should be firmly attached to the body or to the skin of the patient. Yes, this is an important tip that I am giving. Many students they complain that howsoever hard they are striking, but they are not getting any sound. Well, yes, because that pleximeter finger is not firmly attached to the skin. There is some air between this hand and the patient's body, and air is a bad conducting medium, and therefore you are not able to produce any sounds. So remember this: pleximeter finger or this hand which you have placed on the patient's body, this finger should be firmly attached, firmly placed on the surface of the patient's body. Then another important rule: start from the tympanic or resonant area and move towards the dull region. For example, if you are demarcating the hard border, something like this, hard border is here, and start the percussion from the lungs and go perpendicularly from the resonant area towards the hard border in a perpendicular fashion. Another rule which is a guiding principle for percussion: where to start and how to move, in which direction. Now something of an additional information, or physio plus plus as I like to call it. How we can make the complex diagnosis. At times, even with the help of percussion, it is possible. See here, there is a right lung, and let's say there is right-sided pleural effusion. There is fluid surrounding this lung in the pleural space. Now the fluid is going to give you a dull note on percussion. Let's say you are making the percussion over this, on this side, right side, and you get a dull note. Now on the right side there is also going to be the liver dullness. Okay, how can you confirm that this is pleural effusion or it's the dullness of the liver? You are doing this percussion on the right side. How can you confirm this? Simple. You are performing the percussion over the lungs, resonance, 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 and somewhere you get the dull note. All right. Keep your pleximeter finger over there. Don't move it. And then ask the subject, ask the patient to take a deep inspiration. You know what will happen? With the deep inspiration, the diaphragm will simply move down. And as the diaphragm moves down, the liver will be pushed down. Now your pleximeter finger is at the same place, but because of the deep inspiration, the liver has moved down. If it was the liver dullness prior to the deep inspiration, now the liver has gone down with the deep inspiration. Now you might get resonant sound over the lungs. So that dull sound was because of the liver. It will be clear. On the other hand, if you get a dull note and you want to know whether it is pleural fluid or it's the liver dullness, ask the patient to take a deep inspiration, the diaphragm goes down and the liver is pushed down, and if still you are getting the dull note, liver has been pushed down and still you are getting the dull note, that means it must be the pleural effusion. Fluid is going to give you dull note, and this dull note must be that of the pleural fluid. So in a simple procedure, with a simple modification, you are able to come to a certain diagnosis. Percussion is an art, just like the percussion instruments, playing of those instruments is an art. Even this is an art. Clinical diagnosis is becoming rare these days because we have so many advanced investigations at our disposal. But there is no alternative to a good clinical examination and arriving at diagnosis from such investigations, or rather such procedures, clinical procedures by which we can come to a diagnosis certainly.